opinions expressed by guests on this podcast do not represent or reflect the official policy or position of the Take a Paycheck Foundation and podcast. All information shared is from personal experiences and does not constitute medical advice. We do not take responsibility for any statements expressed during the podcast. Take a Paycheck does not endorse any products or services. Any said products or services mentioned on this podcast may not be suitable for you or your condition. Please consult with your physician if you have medical questions, as it may pertain to your condition.
Hi everyone, welcome back to this week's episode on Take a Paycheck. I'm so excited to have Dr. Lori Tucker and Dr. Angela Howe joining me today. Hi Dr. Tucker and hi Dr. Howe. Can you both give me a brief introduction about yourself? Tell me a little bit about your education, your career, and what you've been up to recently.
Thanks, Natasha. I'm really delighted to be here and talk to you today. I'm a pediatric rheumatologist here in Vancouver in BC. I actually trained in the US and moved here quite a long time ago. I'm the head of the division here at the BC Children's Hospital in Vancouver. There are a lot of things in pediatric rheumatology I'm really passionate about. I'm involved in research having to do with physical activity in kids with arthritis, which I think is really important. We've started a clinic here for autoinflammatory diseases, which I think is a great clinical program. And one of the things I'm really passionate about is being involved with families and kids, both in advocacy and research, education and support.
Thanks so much for sharing. Dr. Howe, can you tell me a little bit about yourself?
I am an adult rheumatologist, mostly in my clinical practice, but I do have a background in pediatrics. I'm passionate also about advocacy. I have been involved with the Arthritis Society in a number of different ways and continue to be. I also do outreach up to sort of not northern BC, but mid-northern BC. And I have been doing that for about 25 years. So that's also a passion. And finally, my passion is in diversity, equity, and inclusiveness. And I've been doing a lot of work in that area as well.
Thank you so much for sharing. So Dr. Tucker, would you be able to tell me a little bit about how both of you met each other?
Sure. It's pretty interesting, I guess, or easy. I've met Dr. Howe or Angela quite a long time ago at the Young Adults with Rheumatic Diseases Clinic, really. Also as part of the rheumatology community in BC, we have groups where we get together, but we primarily met through the Yard Clinic. And we've worked together for all this time, and we've also been friendly outside of work as well.
We have a great community here. Our rheumatology community is very collegial.
So what kind of led you to specialize in rheumatology? I know that there's so many fields when you get into medical school that you get to experience in your clinical rotations, and then you decide what you want to do in residency and fellowship. So maybe Dr. Howe, you can tell me a little bit about why you chose rheumatology.
Even in medical school, my very strong interest was in immunology. And I did a couple of electives in immunology. And actually, I was a fellow in the immunology program at SickKids in Toronto for a couple of years. But I soon realized that although intellectually stimulating, it wasn't as clinically stimulating. And I just happened to have a preceptor who was a pediatric immunologist who also saw children who had arthritis. And that really turned me on. So I went on and did a rheumatology fellowship. And here I am.
After I decided to go into pediatrics, which is another story, but I'm pretty sure that my destiny was to be a pediatric rheumatologist, because I will tell you, every step of the way, weird coincidences would happen. Like all of my friends would be taking care of, kids that had asthma. And then I would get an admission for a teenager with lupus who was in renal failure. Or, we got a new department head where I was working, and she was the world famous pediatric rheumatologist. And so along the way, I was also very interested in allergy. But I really began to realize that rheumatology for me had the perfect combination of intellectual stimulation, but also being involved with kids and parents over a long period of time. I found that just so rewarding and so important. So Yeah, it was a perfect fit. And when I decided to go into pediatric rheumatology, actually 3 people told me I should not do it because it was a dead end and I would never get a job. And despite that, I think there's a message for everyone in that, is despite that, I did it anyway. And what I'm saying to all the people who are listening is, you got to believe in what you think is right. You can take advice from people, but if you really feel like something is right for you, you should just go ahead and do it, because it probably is.
Like, I feel that really related or like kind of resonated with me, because when I was diagnosed with JIA, because I had a lot of swelling in my fingers, a lot of my high school teachers mentioned that I should never go into science because I can't write, and science is all about writing. And so that kind of made me feel a little bit upset, because I was like, but that's what I want to do. I want to go into medicine. I want to go into science. Like, I'm very passionate about it. And despite that, I'm aspiring to go into the medical field. So I think it just shows that, you find ways that will work for you, or like things that you can use to adapt to your quality of life to be able to make sure that you want to do it. And so it's so nice to hear that from you. But aside from being a pediatric rheumatologist and being interested in rheumatology and pediatrics, you are also passionate about transition. And that's kind of where, you have that young adult aspect of focus. So can you tell me a little bit about why you are passionate about transition care and what kind of led you to that?
I think when I arrived here at the BC Children's Hospital, the Young Adults with Rheumatic Diseases Clinic here was already established. So I think it's one of the oldest transition programs in Canada. And that program was really unique because it was not a transition, and still is, it's not a transition program for kids who are under age 18. It is for young people who are 18 to 22 years old. It already was running with a pediatric rheumatologist and an adult rheumatologist working together. I wanted to try it out. I wanted to be a part of that. And I came to realize, together with my team and the adult rheumatologist, Dr. Howe, who's been involved, and now we have several other adult rheumatologists, there are some tremendous benefits to that kind of transition program for many young people. And I will say that there's a certain way we practice in pediatric rheumatology. We're kind of like good moms and dads for our patients. And I've learned so much from Dr. Howe, because I take my pediatric hat off when I go to the yard clinic, and I learn how to be an adult physician, and I learn about how the approach is different. And I think that is really valuable for our young patients who are they're going to have to be going to see Dr. Howe and other adult rheumatologists in their offices. So I love taking care of young people and seeing how they're developing. And I also have learned a lot myself.
There is research out there that show much poorer outcomes if children, when they become adults, are not transitioned properly. With the lack of clear follow-up, and with the various issues that young people have anyway, there is often lack of adherence to treatment programs. And we know that, for example, in the kidney program, young adults who've had kidney transplants, if they're not transitioned properly, a greater percentage of them lose their kidney. That's very serious. And it's, as serious for our kids, because without transition, our children or our young adults will flare. They won't get proper treatment as quickly, and their end prognosis is poor. So, and transition is quite the big thing now in pediatrics. There are many transition clinics coming into play in other fields.
What would you say are some of the common challenges that when you get to the clinic, you see that young adults face?
It's a time of great learning and hopefully changes for most young people. So there's changes with respect to schooling. People are graduating from high school. Some people are going on to advanced education. Some people are not. Some people are confused about what they should do. Some people are getting a job, going into the workplace, trying to work out what a job is that would be appropriate for their disease and what their needs are. And then there's social changes. There's peer relationships, intimate relationships, changes in how teens and young people relate to their families. People might be moving out of home. And then there's other things that seem so little, getting your driver's license, which can be a challenge for some people if you need adaptations, and the financial aspects. We find a lot of kids, not surprisingly, when you're in the pediatric clinic with your parents, you don't have to listen to things like, how are my medications paid for and what does that all mean? But when you turn 18, 19, or 20 years old, you do need to learn that. And these are all really important changes that are all happening at once. And I think it can be really overwhelming. So, for many young people, school or work or their intimate relationships are up here, and going to get blood tests or getting to their doctor's office might seem less important at that time. So I think we recognize those challenges, and we try to just support young people through that time by not letting them drop off.
Yeah, I've heard that a lot of young people, as they age and they become older, then they find out maybe when they're like 50 or 60 that their arthritis is doing really bad and didn't have that like follow-up time, or they forget to even go to an appointment, and they're kind of like, okay, I'm 18 and my parents are taking care of me at the pediatric rheumatologist office, and then they take this whole 20 years of not seeing a doctor, which is what Dr. Howe just mentioned, and then they come back later with a huge flare. And a lot of physicians that I've talked to have mentioned that that was one of the biggest challenges that they face. And so they're trying to create more awareness that some of these transition clinics exist, and that can also help support them during that time of transition from pediatric to adult care.
Young adulthood, that transition period, is one of learning about and getting your own independence. And so we have to support young people and their parents in reaching that stage of independence. Sometimes it's hard for parents as well. And so one of the aims of our clinic is to help parents through that as well. And, we make certain suggestions. For example, if a parent calls and has a question, we say, please get your young adult to ask us. And then we can answer the question and they can tell you. So independence on both sides is important.
And have you had any situations where a parent wanted to like stay in the appointment? Like, how do you kind of separate when a parent should be in the appointment with the young adult in the transition clinic, or when it's time for just the young adult to be there? Would you be able to elaborate a little bit about how that works? Because I know a lot of parents feel like they need to be at those appointments. And I know that you just mentioned independence. So how do you make that happen?
Yeah. Well, transition doesn't just start when you're leaving the pediatric clinic at age 18. It really has to start beforehand in the pediatric clinic. So our nurses in the pediatric clinic do a lot of that work, and we do. We talk to parents ahead of time, and if they're coming to the young adult clinic, to the yard clinic, we tell them that they are not coming in the room with their young person. They're not coming in the room. They're free to accompany them there. But the youth is going to come in the room. It's amazing how many kids, I think, find this freeing and really empowering to be given that opportunity, and for their doctors and nurses to say, we know you can do this. You'll be fine. Are there parents that find this challenging? There are definitely parents that find it challenging. And our nurse in the yard clinic tries to help them through that, as Dr. Howe Angela was saying, by trying to provide them with some support as well. It's really hard if you've been taking care of your kid for years and you worry about them, and you're worried that something's going to get lost. And I think our job is to try and help with that as best as we can. I will say there are rare instances where a young person is very, very sick and really does require the support of a parent at that time. And so, we have to recognize that that's important. I'll tell you what I tell a lot of kids, if they're parents, if they say, I need my parent in the room, they must stay there. I say to them, do you want to be a 40-year-old who still has your mom in the room? Probably not, and most kids will say, yeah, maybe I don't. So I think it's really putting yourself into the future, recognizing that you're not your 12-year-old self or your 13-year-old self. You need to put yourself into the future and try out, be doing that.
And I really like how the physicians or the nurses engage in making those conversations, because I feel like as a patient, how do I tell my mom, can you not come in the room? Because she's going to be like, what are you hiding from me? Like, what are you not telling me? And so it's nice to see that other people around you in that environment will help guide you and your parent or guardian through that.
We do have a social worker in our clinic who is an absolute boon for us. He is amazing, and he spends a lot of time with young adults who are having trouble coping. Without him, I think we would have a much bigger job. So I think having him or a social worker in the clinic is a must.
And that kind of leads on to my other question, which was what sort of allied healthcare professionals are in the clinic with you? Is it just you and Dr. Howe? And I feel like we've already kind of covered that, but I'm wondering if you want to add, is there a physiotherapist, an occupational therapist? I know the transition clinic in Toronto does have a physiotherapist, so I'm wondering how it works for you.
We do have a physiotherapist and an occupational therapist, and we have right from the beginning. So we have a very good group, a multidisciplinary group with doctors, a nurse, social worker, and PTOT. And the other thing is that we have access to other people who are working in and out of the Mary Pack Arthritis Center. So we have access to a psychiatrist. We have access to orthopedic surgeons. We have access to a dentist who is a mouth and TMJ specialist. We have lots of specialists that we can directly refer to. And that's also great because we're all in one big building together.
I also want to point out that it's definitely not just myself and Dr. Howe. So there are now, there are 4 of us pediatric rheumatologists who kind of rotate around coming to the Yard Clinic. But we also have 2 other adult rheumatologists who come to the Yard Clinic in addition to Dr. Howe, Dr. Wendy Wong and Dr. Jennifer Corpus. And the real benefit for that, there's so many benefits, they all have different style, different kind of approaches, but obviously people transition out of the Yard Clinic. You have to move on at some point. And they don't all go to, one of those 3 physicians, but many of them do. And, many of the young people who were in the Yard Clinic did end up going to Dr. Howe's practice. Some of them now go to one of the other adult rheumatologists' practice. And I think that provides some comfort and continuity in care for young people who already know, at least, I've met them and I know who they are. So we really are so fortunate to have a young and really enthusiastic team of physicians working together.
And so how do you actually facilitate that transition of care once the patient turns 25 years old?
It's funny because I don't think we don't have a certain time point that everybody has to get to. Some people come to the Yard Clinic at 18 and they're 20 years old and they are completely independent. They kind of have a good idea of where they're going to be, where they're going. And so it is a decision made between the physicians, the nurse, and the patient about when they're ready to leave the Yard Clinic. And then we talk about who might be a good adult rheumatology fit for them. Not everybody lives in Vancouver. They live outside of the Lower Mainland. They might, need to go to see someone else. So it's pretty much a case-by-case discussion together with the young person.
Okay. Patients move different places, and that kind of leads me to my next question. So do you have any patients who moved maybe across the country to Toronto, for example? What do you do in terms of getting them the care that they need?
This is something we run across in the pediatric program, obviously, and this time of the year, stressful time of the year for youth because everyone's waiting for those university application, whether they're going to get the acceptances. So we have found over the years in the Yard Clinic that having kids come to the yard clinic who are going to university in Toronto or in Montreal, it just does not work. They're not home as much as they say they're going to be home, and they're living in this other place and things come up. So in the pediatric program, what we'll do is when kids declare, I'm going to Halifax, I'm going to, Queens or wherever, we make a referral for them to an adult rheumatologist where they're going to be. And if there does happen to be a transition program in that place, we'll try to refer them there. And the converse is we've taken some patients into the yard clinic who have come to Vancouver to go to UBC from other places in the country.
And so, Dr. Howe, how have you seen the views on transition change over time?
Patients that come, or the young people that come to our clinic, really appreciate it. And I know this because I have taken some of these young adults into my private practice after they outgrow the yard clinic. And they all tell me how important that this clinic has been for them. And in fact, I've invited several of them to do little talks to other groups, other parents, other young people with arthritis, and they always stress what advantages, how they were prepared to proceed into the adult world. I don't think you can understate the importance of a transition clinic.
So what can a patient expect if they're part of the yard clinic?
We try to get people prepared before they come to the yard clinic. They can expect to, generally when they come for their first visit, we treat it like it's a new clinic. It's a new doctor they're seeing. They will almost always see one of the adult rheumatologists in the first visit. We will take a full history, including past medical history. And sometimes that's a little bit of a training program for the young person who maybe never had to do that before. We have the information, but we want to go over it with them so that they then are able to do that when they go to see other doctors. How do you give your own history if you've never practiced before? And then they will meet our nurse, they will meet our social worker on the first visit. And together with the physician who sees them, they'll decide, on their medical needs, whether they need to see any other health professionals and set up follow-up. We have some patients, we're doing some virtual visits for transition clinic now for some individuals, if that helps. They will have the contact information of our clinic nurse. And I think that's also really valuable for people. If they're having a problem in between visits, they can email or call the nurse. And one of the physicians is actually on call for the week and can respond to those concerns.
Do you make decisions together as a team, or do they only see like an adult rheumatologist? How does that work?
We definitely act as a team. We have, at the end of every clinic, we go through all the patients seen, discuss them, decide, together what the next steps should be. I mean, the physician who has seen the patient will have an idea of what should be happening next, but sometimes there are conundrums when it's not so clear, and it's really good to discuss it with other people and get other opinions. So every clinic, we go through all the patients that have been seen, and we also discuss. We have a meeting as a yard clinic meeting, just the people in the clinic, and we discuss amongst everybody. So not just who was at the clinic, but all the physicians involved, the nurse and social worker, and we discuss problem cases. Now, these are problems, not problems, people, problem or difficulties in the cases. It could be medical, it could be social, it could be emotional. We have those as well. So it's very collaborative.
Dr. Tucker, can you give me a rundown of what your day-to-day looks like? I know that you mentioned that transition clinic is not the only thing that you do. You do so many other things. So what does I don't know if you could just pick one random day of the week and tell me a little bit about what it's like.
The exciting thing about, I think, my job is that every day is pretty different. So, for example, like yesterday I was in clinic in the morning from 8:30 till about 12 or so, 12:30. We have a clinic follow-up meeting here with, we have 7 pediatric rheumatologists, our nurse, our trainees, our physio, OT, where we discuss patients, new patients, kids who are on the ward, inpatients here. And then we have an x-ray round with the radiologist here. We go over all our x-rays. And then I had 2 research meetings with 2 different groups of people around, one around a paper I'm writing with a group of people, and another around a project that I'm helping a student, an undergraduate student who's working on that project. And then I had a meeting, a department meeting for division heads, so more administrative type of things. It's a lovely and interesting mix of things every day, really. Every day is different.
Yeah, that's what it sounds like. And it sounds like it kind of gives you a different thing to do every single day. Whereas I know a lot of people don't like doing the same thing every single day. This gives you a lot of different variety. And Dr. Howe, can you tell me a little bit about how your days look like?
Well, I'm really lucky. I have semi-retired. So in my private practice, the only people I see now are young adults who've graduated from the Yard Clinic. So it's ongoing, long-term follow-up with these young adults. And it's so exciting because they're getting an education, they're getting into a career, they are finding their partners, they are having children. That's the best part. I love kids. So having little babies come in and then watching them grow up is amazing. So I would say that the oldest person in my practice who came from pediatric rheumatology and then the Yard Clinic is in her 30s, early 30s. And the oldest fellow that I have is actually also in this around the same age and his wife is just now pregnant for the first time. So it's exciting. I love it. Very infrequently I have clinics now in my private practice, but I still come to Yard. I still do Yard, and I do outreach up north into 2 smaller towns that don't have access to a rheumatologist, and I've been doing that for many years, and I love it. I still do it, and the positive part is that there are several people in my practice up there who are young adult graduates from Yard. And so I can continue to follow them, and they're having children, and they're, it's amazing. I think being able to give that kind of long-term follow-up is not only good for them, it's good for me. I can see what's happening and can learn from that as well.
And so, Dr. Howe, you're also heavily involved with the Arthritis Society, something that you mentioned at the beginning of the episode. What is your role there, and why did you decide to get involved with the Arthritis Society?
Well, I think being involved with the Arthritis Society is the advocacy part of being a physician. And the Arthritis Society was started here in Vancouver. Headquarters are now in Toronto, but Mary Pack, who was a teacher who went into the homes of children who had arthritis and couldn't go to school. And she was inspired to start the Arthritis Society. There was already one in the States, and she built it up. So they do great work. They do a lot of education. They do a lot of fundraising. I was on the board of the medical advisory committee to the Arthritis Society, and on the board of the Arthritis Society. I've done talks for the Arthritis Society, so they do a lot of education to the public. I'm hoping to start a diversity and equity program with them through my work up north, because I go to a community that's mainly First Nations, and they have a lot of autoimmune disease in that community. So I'm trying to get that started.
And so, Dr. Tucker, you began a provincial program for children with autoinflammatory diseases at BC Children's Hospital. Can you talk a little bit about the program and its aim?
People may not be aware that autoinflammatory diseases are increasingly being recognized as causing these are causing a lot of trouble for kids. These are rare diseases where they almost always start in childhood, but not always, where children develop recurring episodes of inflammation that are seemingly unprovoked. So fevers, rashes, and they're quite variable. Some are mild, some can be very severe and life-threatening. And it used to be, we recognized that these kids were being sort of sent around on these wild goose chases around the hospital to see the oncologist, to see if it was cancer, the infectious disease, the ENT doctors, various other people. So in, I think it was 2016, we all got together and we started a clinic for autoinflammatory diseases and said, why don't we just centralize where kids come? And so over those number of years, we have a registry for children with autoinflammatory diseases. We have about 200 kids registered in that registry who we are following long-term regularly and collecting information that helps us look at, like, what is the burden of these diseases? What treatments are they on? What's their outcomes? You know, a lot of things that we don't know specifically. We've already been able to do some amazing things with the information we have. We published a paper about a year or so ago looking at ethnicity, because as you may be aware, in BC, we have very diverse ethnicities and many people have mixed ethnicities. And so we published a paper showing that there are not single ethnicities that present with certain autoinflammatory diseases. We showed that for the first time that there are individuals of Indigenous background who have autoinflammatory disease, which hadn't been published. And we worked together with a PhD scientist in our pediatric rheumatology lab here, collecting samples. And we are working on looking at new biomarkers that will help us understand and predict why these kids are having episodes of disease. Slowly, some of these young people are starting to graduate and move into the young adult clinic. Interestingly, many kids with autoinflammatory diseases just get better before they get into adulthood, which is kind of weird and hard to understand. But so I also work together with other pediatric rheumatologists across Canada on this, from all the centers across Canada. We're doing education. We're working with some researchers that are in the US. So when you take care of kids or young people with rare disease, you've got to work with other groups. You can't do things on your own.
That's so interesting. I've always been interested to know more about if and how ethnic backgrounds could relate to autoinflammatory diseases and autoimmune diseases. I think it's something that's very interesting and a lot of people don't really look into. So I'm glad that you and other rheumatologists are looking into that. So what were some of the challenges you experienced when creating this program?
Well, first of all, lack of funding, which I think is still a problem. It's always difficult to get funding, both to support the program, the things that the patients need, which is nursing, social work, but also funding for research, which I think is challenging to get. And I wouldn't say it was a challenge. It was actually really fantastic to get together all of the diverse sort of groups like immunology, ENT, infectious disease, oncology, all the people who were seeing these patients coming together who had some really great ideas about how to put together a program like this and how their roles might fit into that program. So some people might see that as a challenge. I think that was just a tremendous opportunity, getting together some really collaborative people. And we're really at a point where we have a lot of patients and really we're currently kind of looking at what can we do next? How can we move forward? We actually, through Cassie and Friends, we have worked to develop a parent group, actually, because this is a big issue. We really need a parent group to tell us as clinicians and researchers, what are the problems that you face with your child as a family that you want us to study? So we're really trying to hope to work with them collaboratively to drive research and resources moving forward.
You briefly mentioned that, you're looking for next steps and like talking a little bit about what are the next steps. So I'm curious to know, like, what are your plans for this program? You mentioned a little bit about now how you're trying to incorporate perspectives of parents to get some more guidance on what to do next, but do you have anything that you envisioned for the future of this program?
Yes, well, we have some very definitive goals that we're interested in. I think where COVID and the pandemic really threw a real monkey wrench into trying to develop research programs. You can't see people in person and couldn't get blood samples. So I think we're sitting down with the researchers side of things and trying to plan how to reinvigorate collecting blood samples from kids with autoinflammatory diseases and biobanking them together with information so that we can, in our center, but also collaboratively with other centers across Canada who are interested in this, we can participate in some really important research to understand, what's driving these diseases, how do we identify them better, how do we treat them better. So that's one thing, is drive the science a little bit better. I'm really keen to do some work on describing the burden of disease, both to kids and families. So we have some information about that we'll probably be looking at analyzing and publishing. And then one of the things I think we'll probably be looking at, not just in autoinflammatory disease, but in our team here, we're very interested, as are many people, at looking at the mental health burden of arthritis and other autoimmune and autoinflammatory conditions in kids and young people. So we're taking a look at what other teams are doing, working on how we can better screen for these problems early rather than waiting for real crisis situations, and what kind of supports need to be put in place for kids, families, young people around mental health issues. That is something we've talked about in the Yard Clinic, and our social worker has developed. We are currently doing routine screening of all kids who come to the Yard Clinic for mental health issues. We have a pathway set up with resources that are available. So I think that's something that we're really focused on.
And Dr. Howe, you mentioned briefly about equity, diversity, and inclusion and how you're very passionate about that. And you're involved in providing this education to healthcare professionals in the Fraser Health Authority. Can you explain a little bit about what equity, diversity, and inclusion is to people who may not know?
Well, I think that the best example would be the difficulties that Indigenous people have had with colonization and the colonizers, and all the trauma that they have felt. But we're talking about racism in any form, and we're also talking about feminism, and we're talking about ageism. We're talking about every person on this planet, really, basically. So there are different programs to help educate, at least in my field, other medical providers about Indigenous trauma and Indigenous rights. But we also talk about racism. We talk about, in Vancouver, for example, there's been a lot of racism and hate towards Asians, mainly because of the pandemic. But it's a big field, and we're trying to make sure that people can be recognized as valued individuals, and that not everyone is the same. Equity, in other words, presented with the same opportunities across the board to all individuals. And that could be in employment, that could be in school, that could be in any number of fields. And inclusivity is to make sure that all our institutions provide opportunities to people of all ages, all ethnic groups, sexes, etc. It's a big field, and you can branch off and just look at one little aspect. I'm very interested in the Indigenous part of it because one of the communities that I go to up north is largely Indigenous. And I have pretty separate issues working with them and them with me than I would down here in Vancouver. And so we want to make sure that we are meeting these people on an even ground. I've gotten to know these people and they're wonderful people. And they've had a very, very rough time.
I think it's really important that we make sure that everyone is given the attention that they require and treated equally. So I'm so glad that you are working on this amazing research and helping out in the community to make sure that we are treating everyone right. And so I'd like to end off the podcast episode with an advice segment. So Dr. Tucker, what resources would you recommend to young people who have been recently diagnosed with any sort of rheumatic disease?
So if we're talking about young people who are sort of, not 2 and 3 year olds, obviously, who are, maybe early teenagers who've been diagnosed with the rheumatic disease, the first resource is your pediatric rheumatology team. So your doctor, your nurse, physiotherapist, occupational therapist, they can provide you, particularly the PT and OT can provide you with really fantastic resources and really hands-on help to help you to succeed at school, with sports, and other, sort of areas in your community. So that's the first place to go. The second place, when you have recently been diagnosed, is to go to the Cassie and Friends Society website. There is an enormous amount of information there for kids and for parents on so many different topics. For many kids, camp. The Arthritis Society runs summer camps now in every province and across the country. So those are some easy ways to get started that anyone can access from wherever you are.
And so, Dr. Howe, what advice would you give to youth who are hesitant about joining a transition clinic?
Well, I think I would speak to each individual with regards to their own circumstances. But part of it is helping youth gain independence. Everybody goes through that, everybody. But especially for young people who have a chronic disease, they have to learn how to manage their disease. And so I think what is the most important is to say what we want for each of you is low disease activity. Well, how can we get you feeling better more often for more of the time? And I think that is the number one aim that we should have towards these young adults.
The one thing I would say when it comes to being hesitant or worried about transition is, I've been a pediatric rheumatologist a long time. Most kids don't really want to leave the children's hospital. It's a wonderful place. We've had people beg to stay, right? That we're very motherly. We take good care of you. They're used to us, right? And it really has to do with the fact that change is difficult. It's exciting, but it's difficult. And that change into an environment where you don't know the place, you don't know the people, you're not sure what can happen. It's our job as a team really just to acknowledge that and say, yep, this is hard. We agree it's difficult, but we're going to help you through it. And I firmly believe that the best help that young people with rheumatic disease can get is in a transition clinic, because on the other side of it are people who are warm and welcoming and understand that it's a difficult time. I'm part of a transition clinic and I feel it's important. I think it's really the best chance that someone can have.
Thank you so much, Dr. Tucker and Dr. Howe, for joining me on today's podcast episode. We started off the episode by talking about how you met each other, and then we discussed your interest in rheumatology. Then we dove in and talked a lot about the Yard Clinic, a transition clinic in BC, and the value of having a dedicated transition program. And finally, we dived into your initiatives and interests, how Dr. Howe's involvement with the Arthritis Society, and we talked a little bit about her passion for DEI education. We also talked about how Dr. Tucker created an auto-inflammatory diseases program at the BC Children's Hospital. Everyone, like, comment, subscribe, check out this episode on different platforms, and I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much. Bye.
Thanks so much.
Thank you.
Okay.